In aesthetic medicine, one of the most powerful skills we can develop is learning when to say no. While we are here to help patients feel their best, not every request aligns with safe or realistic outcomes. Today we'll explore why, when, and how to make those tough calls for the benefits of our patients and our practice. Saying no when necessary is the core of ethical practice. It's essential for protecting patients' health, preserving professional integrity, and often strengthen the patient-provider relationship in the long run. So let's dive into the details of what that looks like. First is managing patient expectations. Building trust is the key in our work, and that starts with honesty. When we set clear, achievable expectations right from the beginning, we lay the groundwork for trust and patient satisfaction. For example, if a patient is seeking a one-time Botox treatment to eliminate deep forehead lines permanently, it's important to explain that Botox usually lasts between 3 to 6 months, and that deeper lines might need several treatments or alternative options. This helps the patient understand what's truly achievable and avoids disappointment in the future. Unrealistic expectations often lead to dissatisfaction, even if the treatment itself was technically successful. Helping patients understand their options empowers them, allowing them to make well-informed choices about their care. Take, for instance, a patient hoping that a filler will give them flawless skin texture. They may not realize that fillers are fantastic for adding volume, but won't erase all imperfections. By providing this clarity upfront, we prevent any frustration or misunderstanding about the treatment's purpose and potential risk in the future. The next part is understanding patients' motivations and concerns. Patients come to us with various motivations, and these can range from enhancing self-confidence to preparing for a special event. Understanding their why enables us to guide them toward the treatments that will best meet their needs. For example, consider a patient who wants lip filler because she feels her lips are too thin compared to what's popular on social media. By addressing her concerns and encouraging a natural enhancement, we can help her achieve a result that's safe and aligns with her true aesthetic. Listening closely also let us tailor our approach to address each patient's specific concerns. For instance, a patient with deep wrinkles might need more than filler alone. We could suggest combination filler treatments that boosts collagen for the best results. The next part is identifying unrealistic expectations. Now let's talk about the red flags that help us identify when a patient's expectations might be unrealistic. First, body image. Listening to how patients describe their goals can reveal whether they view their body in a positive or overly critical way. For example, if a patient brings in edited photos or wants to mimic a celebrity's features exactly, that's a red flag. That's a sign we need to help them adjust their expectations to something achievable and authentic to them. Lifestyle is another factor. Some procedures require dedication, including post-treatment care or lifestyle adjustments, which not everyone is ready for. An example, a patient who is seeking body contouring, who isn't committed to maintaining the results with exercise and a healthy lifestyle, may not achieve lasting satisfaction. Setting these expectations early helps them make an informed decision. Then there is the medical history. Reviewing this is very crucial, as some conditions or medications may contraindicate a procedure. For example, a patient on blood thinners may experience excessive bruising from injectables. By spotting these details, we keep the patient's safety front and center. Finally, we need to assess expectations themselves. A patient who expects a total transformation or drastic change may need guidance to understand that aesthetic treatments aim to enhance, not completely alter. Also, educating patients on procedure limitations is very important. Helping patients understand the limitations of aesthetic treatment is one of the most important parts of our role. Many procedures offer beautiful results, but they aren't magic. Take, for instance, a patient who hopes that lip filler will double their lip size. We should explain that while enhancement is possible, or even making the double size is possible, going too far can look unnatural and increase risks. This kind of education keeps expectations realistic. Results also vary due to factors like skin type, age, and lifestyle, and it's our job to explain that their outcome will be unique to them. For instance, if a patient shows us a photo of someone else's results, we can gently clarify that while they'll experience improvement, their outcome might look different based on their unique feature and aesthetic. And of course, every patient needs to know about potential side effects, risks, downtime, and aftercare. For example, a patient getting a chemical peel should expect some peeling, but the extent can vary. So transparency here is the key. The other thing I want to talk about is the techniques for delivering difficult news compassionately. Let's cover how to approach difficult conversations with compassion and care. First, active listening. When a patient shares their desires, listen attentively, nod, and show understanding. For example, a patient may feel vulnerable about an insecurity, and active listening shows them that they are respected and understood. Clear and honest communication comes next. Avoid using medical jargon. Instead, explain things simply and directly. For instance, if a patient expects flawless results, we can kindly inform them that subtle, natural-looking improvements are achievable, but perfection isn't. Offering alternatives is a powerful tool. When saying no to one treatment, suggesting another approach can leave the patient feeling supported rather than rejected. For example, if a patient isn't suitable for an invasive procedure, we could recommend non-invasive options which may better align with their goals. Also, you have to consider your ethical responsibility to avoid harmful treatments. Above all, we have the duty to prioritize patient safety. If a procedure is risky or not in the patient's best interest, it's crucial to say no. An example is a young patient seeking Botox for barely invasive lines. Explaining the risks of over-treatment and offering a lighter approach ensures we are looking out for their long-term well-being. Maintaining our professional integrity also means never compromising our ethics for financial gain. If a patient insists on unnecessary treatments or excessive filler, it's our responsibility to recommend only what's appropriate, even if that means doing less or making less money. And finally, legal implications. If we perform a treatment that's not in a patient's best interest, we could face legal consequences if something goes wrong. So prioritize informed decisions, safeguards both patient and practitioner. In conclusion, upholding professional standards is everything. Remember that saying no can sometimes be the most respectful, ethical, and compassionate choice we can make. Patients may not always be happy with hearing no, but they'll appreciate your honesty and respect your professional integrity in the long run. By helping patients understand the realities of aesthetic medicine, we foster a more transparent, ethical approach to care. This commitment to ethics sets a high standard in aesthetic medicine and strengthens our relationships with patients. Thank you for focusing on safe, ethical practices and for empowering your patients to make the best decisions for themselves.